11,605 cases of COVID-19. Again, remember this includes confirmed cases and probable cases of COVID. Yesterday, we added 76 new cases to our case count, and we're reporting 244 that have died with COVID. This was an increase of 2 from the number that we reported yesterday. Cumulative hospitalizations for COVID-19. Again, this number comes out of our AIMS database and contains information on Mobile residents and also residents of other jurisdictions that are hospitalized in Mobile County hospitals. So the cumulative number hospitalized is 657. That was an increase of 25 or so from yesterday. On the last page of our report, where we show the number of people currently hospitalized, yesterday all hospitals were not reporting. That's why that bar for yesterday is red, but we're reporting 134 people hospitalized with COVID yesterday. So our numbers of the number of cases of COVID reported to us are continuing to be much lower than they were in July. The number of people hospitalized with COVID is continuing to go down. And when we recalculate the percent positive among all COVID laboratory tests, we hope to report to you on Monday that has been going down steadily as well. The other indicator that we use is the ADPH risk indicator dashboard. This is only updated each Friday, and it's updated on Friday for the week prior to now. So the data that's updated today on the risk indicator actually were through this past Saturday. So it is a little bit of a lag. Mobile is now showing in the yellow category as having moderate risk. We're still seeing a declining number of cases, but according to ADPH, our percent positive is no longer declining. We're still meeting our testing goals, and we're still seeing a decline in the emergency department visits for COVID-19. So those are all good indicators. So please continue, wearing your mask, keeping a 6-foot distance between you and others who don't live in your household, and stay at home if you're sick, wash your hands, disinfect, frequently touch surfaces, all of those things that we did to get the numbers going in the downward trajectory, unlike what we experienced in late June and July, where it was just, going up and overwhelmed us. So please keep following the public health measures to try to keep the numbers low. We often report the number of complaints that we've responded to. I have the report from our inspection services, which is all permitted facilities. So there have been around a dozen complaints that our inspectors have dealt with this week from food, retail, schools, or daycare. All right, I have a couple of questions and some other information to share. So I get this question every couple of weeks, and when you look at the daily report, let me go back to this, let me see. When you look at the daily report, we have the cumulative number of COVID cases, and then the number that was reported to us yesterday. And if you did the math, if you subtracted this number from the same number yesterday, the difference would be greater than 76. And that's because when things are reported, they sometimes are reported they fill in some of these previous weeks and days. So just to do the raw subtraction does not arrive at the number that was added yesterday, because sometimes when we change jurisdictions or when some processing is lagging, these counts for the previous days will rise, and that is not included in the number that's reported yesterday. It is, however, included in the cumulative number. So it tickles me that someone's out there checking our math on that. So let's see, some other questions, these from the media and from Facebook. Someone from the media heard a report today that vitamin D deficiency could play a role in the severity of illness associated with COVID infections. And there have been some reports about the role of vitamin D, but it's very difficult to tease the individual contribution of vitamin D to more severe illness, because vitamin D deficiency is wrapped up in some other conditions that might also make someone more vulnerable to COVID complications. So it's really hard to sort of tease out specifically what vitamin D might be doing to play a role in the severity of illness associated with COVID, because there are other factors that go along with vitamin D deficiency. So then the statement goes on that the report stated that 10 to 15 minutes outside at peak UV ray levels, usually 10 a.m. to 2 p.m., should provide enough rays to produce your daily requirement of vitamin D. And yes, that's probably true, but remember, there are also some negative aspects to being out with in the sunshine without protection between 10 and 2. We don't want to, get you severely sunburned trying to get your vitamin D up. So please, everything in moderation. All right, so what's the difference between 14-day and 10-day? All right, if you test positive for COVID-19, you must isolate for 10 days. If you have symptoms with COVID-19, you must isolate at least 10 days, and at least the last 24 hours you have to be symptom-free. If you're not symptom-free on day 10, you have to continue isolating until you are symptom-free for at least 24 hours. Again, if you're COVID positive, you must isolate for 10 days. If you have been exposed or if you have been around someone who tested positive, you have to quarantine for 14 days. If during the 14 days you become symptomatic, then you should get tested, and if you're positive, from that date you should stay at home 10 additional days. So I hope that clears it up. 10 days is for people who are COVID positive. 14 days are for people who are exposed to COVID positive. All right, here is a question. If a coworker tested positive today and someone worked with them yesterday, would they have been exposed? So it depends. If they got sick today, anyone who was around them for 15 minutes or more within 6 feet for the previous 2 days would be considered exposed and would have to quarantine for 14 days. So if they got sick today and you were yesterday, you were around them, and that, while you were around them, if you were within 6 feet of them for 15 minutes or more, cumulative during the time that you were around them, you're considered exposed and you should go home and quarantine for 14 days. All right. A question about asymptomatic spread. Yes, we know we have asymptomatic spread now. That is not something that we knew in March. We know that people test positive and can infect others even though they have no symptoms. Are there certain symptoms to look for in babies? My 18-month-old is sick and I'm wondering if I should have her tested. Well, you should contact your pediatrician and have a conversation with them. If your baby is sick, then you want to consult with your pediatrician or healthcare provider so that your baby can get evaluation for his or her sickness. All right. Someone is asking about some fluctuation in the numbers and the number of tests, and are we seeing a reduction because we have reduction in testing? That is partially true, part of the explanation for sure, but we still feel pretty good about declining transmission because we're seeing hospitalizations go down, we're seeing the percent positive go down, and we're seeing our case count go down. All right, I wanted to bring your attention to a news release that was published by the Alabama Department of Public Health. I believe this was yesterday, on Thursday, and then re-released by our department this morning, that talks about testing priorities for COVID. So let me just kind of hit the high spots. So the priorities for testing, when testing is limited or when it's slow, we want hospitalized individuals with signs and symptoms of COVID to get tested. We want other symptomatic individuals and those that are at highest risk to get tested. So people that live in congregate settings or have underlying health conditions or are very old. And then we want other people who are who are not experiencing symptoms, asymptomatic people to kind of be at the end of the line for testing. Let's see, the types of tests. Also, this news release goes into the types of tests. It specifies, the difference between a diagnostic test, talks about PCR, antigen, and the antibody tests. So the PCR and the antigen test are diagnostic, but the antibody test is not. Also provides clarification on isolation, quarantine, and returning to work. So again, goes through the 14-day quarantine time that's required. It talks about how employers should not require a negative laboratory COVID test as a requirement for return to work. Something we've been saying for some time. Also specifies that a person who tests positive does not need to test again or should not test again for 90 days unless they develop new COVID symptoms and they have no other explanation for their illness. Talks about quarantine, and I believe that's it. So all of that kind of in one concise document. So when we get your additional emails and Facebook posts about how long to quarantine and isolate, we can just refer you back to this document. It has it all in there. All right. Last thing for today is about preparing for hurricanes during COVID-19 pandemic. So we now have a named tropical storm, Laura, whose direction is still a long way off, expected to sort of start causing trouble in the Gulf maybe on around Tuesday into Wednesday. So still a tropical storm. We are kind of in the cone, at least the way the cone is shaping up now. So we want to remind everyone that planning for hurricane season and other disasters can be stressful, but we want you to think about some important things. So gather your supplies, have your flashlights ready, make sure you have your medication, everything, your important documents, everything in a spot so that if you need to evacuate, you can scoop those things up and evacuate. About evacuation, we don't want a shelter, a general population shelter to be your first or only option for sheltering if you have to evacuate. We want you to think about staying with relatives or friends who live further inland so that we can avoid putting people in a situation of potential exposure during COVID-19 pandemic. So again, a shelter should be your last resort. Please know a safe place that you can shelter and have several ways to receive weather alerts, including cell phones, weather radios, and local news. Local officials will make determination about whether or not shelters need to be opened depending on the storm and other factors. So please prepare your go kit with personal items and other things, add things that can protect you from COVID in that go kit, such as hand sanitizer, maybe soap and a wash rag, your mask, your face coverings, those sorts of things, so that you have those in your go kit should you have to evacuate during a storm. And don't forget to make plans for your pets, because pet shelter space is often very limited. So again, please let a public shelter be your last option should you have to evacuate. And if you do find yourself in a situation of having no other place to evacuate to, make sure if you go to a shelter that you try to keep that 6-foot distance, wear your face covering, wash your hands, and those sorts of things to try to keep others and yourself safe in that shelter setting. So I think with that, unless there are other things on Facebook, I'm hearing none. So, have a lovely weekend. Try to prepare in case you're in the path of the tropical storm Laura when she makes landfall next week, and in case we end up being in the cone. It's just, it's an incredibly stressful time, but we can continue working together to protect ourselves and our community. We need your help, and we thank you for the role that you play. So we'll talk to you next week.